here I am post surgery, and I have to say I feel better than when I went in terms of my headspace. I'm extremely grateful in the fact that I came out of it, and the guy upstairs, look at my swollen hands, took care of things. Well done. Now I'm just really trying to manage this pain. It's like a overwhelming soreness to my chest. Fear is the antithesis of faith. So I'm going to practice faith again because we have to get the pathology report back on my nodes and on my breast tissue. And unfortunately, we had one node that was inflamed, I guess, from what I heard. So I'm not sure I'm ready for another piece of this to manage. It's the day after. Ooh. I'm learning that out of the medication I'm taking, the Valium is like the best because of the muscle spasms. So that really is helping with me breathing, because I was trying to do my breathing exercises yesterday and I kind of couldn't because it's like very, very tight. But Dr. Chopra came by earlier today and liked everything he saw.
Working with these breast reconstruction patients has really sort of changed my practice and the way I look at things, and it makes me happier. And these patients really need your help. Not that other patients don't, but these patients didn't ask for this. They didn't choose to have it. They aren't choosing to have their breast augmented. This is just true reconstruction, just to make them feel whole again. And by doing that, it makes me feel like I'm helping and giving back. But the most important thing is to get them cancer-free or reduce their risk as much as we possibly can. That's the most important thing. And I need them to grasp that. Once they can do that, then we can sort of get into the expectations of what to expect aesthetically.
I was able to be filled up with my expanders about 270 cc's per side, which was great, and I'm very grateful for Dr. Chopra for giving me a little bit of that because it does give me some elevation and I'm not completely flat. On pain management standpoint, I've been mostly now dealing with Tylenol and a Valium because the Valium helps the tenseness that happens up in the chest area. So typically I can just wear a shirt, a button-down shirt like this that covers kind of everything with the drains and with the clear dressing. But for right now, this will be the left side. There's a little bit of bruising, and that was from the hematoma I experienced. I was known as the hematoma patient when I went in to have the mastectomy. But basically you can see sort of how much I've been left with in terms of the amount of spacers and cc's that was put in. The right side, which was my problem side, which is where we found the gnarly cells. You can see it's just, again, a little bit inflated. So here's a side view of the steri-strip, the spacer, and then a little bit under the arm where the drains are coming from. So you get two drains, technically from each side, and they come from, it's hard to see it, but they come from the armpit area. I can't lift my arms very much. And within those drains are liquid that needs to be emptied either AM or PM. And it's supposed to kind of help all the healing. I'm not actually sure what the fluid's for. I think it's a mix of blood and fluid and things like that. Today was a good day. Today was a day I prayed for really, really fervently, very, very, very strongly.
Good news!
Okay, let's keep going.
Hi. 6 negative notes. 6 negative notes.
And I was happy to see Dr. Funk today because she provided me with the news that I think every patient who comes across this wants to hear, and it was basically all of my pathology reports for my tissue, and my nodes came back all clean and clear, which means right now, in this stage, no radiation.
One of the key things which I didn't speak about is that they have to let go of the process and let me take care of them. A lot of people are type A and they want to know every single thing that's going on. And at a certain point, they have to be like, all right, I trust you, you do your thing, and I'll do me. And it's hard to get those patients to get to that level, but once they said, okay, I'm going to trust the process, you're in charge, Christy's in charge, let's do it.
I am pleasantly surprised, grateful for my doctors, and grateful for my body for treating me so well and being my buddy.